There is no need for alarm about Zika, health officials say, as they maintain that the key to reducing mosquito-borne illnesses like Zika, dengue, and chikungunya is by removing the breeding areas, and this includes using new technology in the form of genetically modified mosquitoes. On August 24th, the BVI reported 5 confirmed cases of Zika. The Ministry of Health and Social Development said the cases were contracted in the Cane Garden Bay and Havers areas on Tortola. Health Minister Ronnie Skelton, in an August 30th statement, said it was expected that Zika would reach the BVI and there is no cause for undue alarm.
The Ministry of Health, working with other partners, continue to make every effort to prevent and minimize the impact of Zika and other mosquito-borne viruses such as dengue and chikungunya. We do this by promoting the most effective means of prevention, elimination of mosquito breeding sites, and personal protection. For most persons, the symptoms of Zika will be a mild fever, rash, joint pain, red eyes, muscle pain, and headache. And they will not be sick enough to be hospitalized. In fact, only 1 in 5 persons infected will actually have symptoms at all.
The BVI is among 28 Caribbean countries to have confirmed cases of Zika, which is also prevalent in neighboring Puerto Rico and the U.S. Virgin Islands. According to Minister Skelton, ongoing efforts have kept the mosquito population at a very low index in recent months. Health officials say, in addition to eliminating mosquito breeding sites, persons should also report any cases of Zika.
We need the case reported so that the vector control team can do an investigation around the area where the case frequents, whether that be their homes, where they play, where they work, so they can determine if there's mosquito breeding in that area, if they're active adults, and what they can do to break that chain of transmission. Because if we simply do nothing, what will happen is that more persons will become infected. And what we would have is, in the ensuing weeks, we'd have more crops of infected mosquitoes being hatched. So it's important for these cases to be reported so that the vector team can actually get in and break that chain of transmission.
Maintaining that there is no need for alarm regarding Zika, Dr. Mitchell Penn of Penn's Medical Center says vector control is essential and suggested the use of genetically modified mosquitoes.
Well, Oxitec, one of the companies internationally, have actually impregnated mosquitoes with a virus that can infect other mosquitoes, making the mosquito barren so it cannot breed new offsprings. And they've already reported in some of their studies the mosquito population, the Aedes aegypti mosquito population, dropping by an alarming 90% on the first run in their environments. So these are things that I think that we, as a community, will be looking at in terms of eliminating what we're seeing. So the constellation of symptoms that we see as Zika, dengue, and chikungunya may be a thing of the past once we remove the actual vectors. We have a guppy program in the country where people would put guppies in their systems to help to limit the amount of the larvae that are in their systems. Not many persons are doing those things, turning over the water containers that are around their premises, etc. Those basic things are still necessary to limit what we're seeing. So we're at the stage now where we are worried about the disease because we've forgotten to deal with the prevention. And so the Zika in itself that we have is just simply a call to us to become more awakened to doing the things that environmental health has been preaching. Don't wait for the mosquitoes to breed, stop them from breeding. And so that's why we have to get some Oxitec mosquitoes in the country, perhaps.
Residents can report any suspected mosquito breeding areas in their environment to the vector control team at the Environmental Health Division for immediate attention.